This 28-year-old woman was paralyzed by a chiropractic adjustment. Meet Caitlin Jensen, a Georgia Southern graduate whose life took an unfortunate turn during a regular visit to a chiropractor. Caitlin was experiencing stiffness in her neck after long periods of sitting at a desk while studying for finals. She was otherwise healthy and active. She had visited her chiropractor for similar issues in the past. Unfortunately, this time,
4 arteries were ruptured. She suffered a stroke and cardiac arrest.
and you know how I feel about chiropractors. Or, well, dodgy chiropractic techniques. I suggest you buckle your seatbelts. We've got a lot of ground to cover. I can only imagine how terrifying this was for her mother, who received a concerned call from her chiropractor.
I got a phone call from her phone, but it was actually the chiropractor. He told me that she was having a reaction to the treatment.
I wonder if he used those exact words, reaction to the treatment. Is that a common euphemism for multiple ruptured arteries, a stroke, cardiac arrest, and paralysis that I don't know about? The truth is that Caitlin almost died. Caitlin was rushed to the hospital where she would spend the next couple months of her life in intensive care. Luckily, if the patient survives the initial stroke and complication, the chances of survival increase dramatically. But after suffering an injury like this, there yet lies a long road to recovery ahead.
She can communicate only by blinking. She can nod now. She can also give us a thumbs up or a thumbs down on the left side.
And despite her best efforts, Caitlin may never regain full function. She was recently transferred to Shepherd Center, which specializes in rehabilitating injuries to the brain, spine, and spinal cord, where she's giving it her best shot. Our guest lecturer today is neurologist Brandon Bieber, who holds a subspecialty in multiple sclerosis and immunological disease, which is the subject of many of his YouTube videos. His discussion will help me explain vertebral artery dissection and how it relates to chiropractic adjustment, as he has seen people suffering from this complication firsthand in his own clinical practice. Dr. Bieber, if you'll please introduce our first topic.
Cervical artery dissection and stroke occurring after rapid thrust manipulation of the neck by chiropractors.
So there are 4 main arteries that supply oxygenated blood to the brain, which needs oxygen to function. 2 carotid arteries and 2 vertebral arteries. The carotid arteries can be felt on each side of the lower neck, immediately below the angle of the jaw. You know, where you check your pulse. The vertebral arteries run through the spinal column in the neck to provide oxygenated blood to the brain and the spine. Listen as Dr. Bieber describes their seamless integration with our spine.
The spinal vertebrae have transverse processes which extend laterally.
Let's get a close-up on a spinal vertebra.
Let your backbones fly.
And those processes have small holes in them called transverse foramina, and the vertebral arteries actually go through those holes.
Essentially, these extremely important blood vessels are contained in a tunnel of interlocking bone loops.
And so they actually cannot be compressed externally, and they're also sort of stuck in place.
This isn't problematic when the spine is relatively straight, but can you imagine what could happen to the vertebral artery if 2 foramen loops snap violently and quickly out of alignment? This is a room full of chiropractors learning how to perform a rapid thrust manipulation of the cervical spine with greater speed. Hallelujah!
Rapid thrust manipulation of the neck by chiropractors involves the chiropractor taking 2 vertebrae and sort of jerking them.
And obviously, there are many chiropractors who take this technique to the extreme, treating every patient that comes into their office with a myriad of aggressive jerking type treatments.
I should put my mic on their neck. The patient can hear it even more because the neck is the only joint with ears.
Neck, only joint with ears. Got it.
Hey Siri, do we have extra ears on our neck?
Hell no, to the no, 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 yeah, to the no.
Let's get back to the matter at hand, cervical artery dissection.
Unfortunately, this is a extremely rare but well-known complication of this intervention.
Chiropractors will tell you the same thing.
About 1 out of 100,000. So very, very uncommon. I've probably given 300,000 adjustments in the 20 years of practice, and I've never had this situation occur.
For my part, I'm glad that we have a neurologist with clinical experience who can quote a similar number.
The risk of this occurring is estimated to be around 1 in 100,000 to 1 in 1 million.
Unlike practicing chiropractors, Dr. Bieber has no vested interest in continuing to use rapid thrust manipulation as a mainstay in his treatment. He goes on to say,
also, this is essentially an idiosyncratic, unpredictable event, probably not related to the technique itself.
And I want to commend him on his scientific and unbiased treatment of this issue at hand. Admittedly, we don't hear about this type of thing happening often, so 1 in 100,000 might not be an inflated number. But then again, during my research for this video, I found estimations as high as 1 in 20,000 spinal manipulations result in a vertebral artery aneurysm or dissection and ischemic infarct. The exact statistic seems to bend based on who you ask. But I'm skeptical by nature, and I wasn't willing to stop there. One study in the Royal Society of Medicine states, spinal manipulation, particularly when performed on the upper spine, has repeatedly been associated with serious adverse events. Currently, the incidence of such events is unknown.
And Jesus, that should have broke my index finger.
Adherence to informed consent, which currently seems less than rigorous, should therefore be mandatory to all therapists using this treatment. This is an excellent point. Even if this adverse reaction is rare and the exact measurement unknown, it is well documented in a myriad of case studies, as we soon shall see. It does happen, so the point about informed consent is absolutely key. I wonder how many people would willingly lie down for an adjustment like this.
So let's side bend him and lock him in there and lock. There we have it there.
If they knew that a rapid thrust manipulation of the cervical spine could leave them like Caitlin.
Caitlin's mom has this message for anyone thinking of going to a chiropractor.
People should stop having neck adjustments. It's not worth the risk.
I don't know the likelihood of people stopping chiropractic treatment altogether, as many have found relief in this form of manipulation. What do you think, Dr. Bieber? Is there a more conservative approach to this issue?
And I'm not saying it shouldn't be done, but people should be aware of the risks, and maybe if someone has a very minor problem, a more conservative approach may be a better way to go.
An excellent contribution. Let's think about it this way. As a surgeon, I am painfully aware of the risks involved in what I do. And before you lie down on the operating table, we will explore all other treatment options that may be available to you. If we do need to move forward with surgery, you will be made aware of the risks involved. And once you're under the knife, I will treat you with the safest techniques available to me. I will not treat the stiffness in your neck with a technique that could paralyze you and change your life forever. This is one of the reasons why the one-size-fits-all, high velocity and high volume cracking approach that is glamorizing chiropractic culture frustrates me so much. Unfortunately, we live in a world where sensationalist titles and loud cracks equal more clicks. Another study by Dr. Edzard Ernst, published in the International Journal of Clinical Practice back in 2010, sheds more light on the problem. His goal was to summarize all cases in which chiropractic spinal manipulation was followed by death through a systematic review of case reports. Ernst only found 26 fatalities adequately reported in approximately 80 years of literature, in a systematic review that shows significant correlation between high velocity, short lever thrust of the upper spine with rotation and death. One possible cause of this form of treatment is, interns, say it with me, vertebral artery dissection. And I want to point out that you don't need to die for this type of injury to dramatically alter the direction of your life, as was Caitlin's experience.
Dr. TJ Harpham declined to discuss the incident, citing patient confidentiality.
Doesn't the number of deaths reported seem suspiciously low?
Something's not adding up.
If your livelihood depended on administering this type of treatment, would you be keen to provide a detailed report about the incident in question? Or would you too cite patient confidentiality in an attempt to save face?
Just wanted to see if you had any comment about Caitlin Jensen.
No, I have no comment. I can't talk about any case or any patient.
I don't know. It's hard to watch and uncomfortable to think about what you might do or say in his shoes, especially as the reporter continues to press for an answer.
Was it just an accident? Was it just an accident?
I have no comment about anyone or anything.
Look, I'm not here to point fingers. I just want to help people make informed decisions about their health. Caitlin's mom makes a great point.
Do you blame the chiropractor?
Blame is a strong word, and I feel bad for everyone in this entire situation. Nobody wanted this.
I agree. Nobody wanted this. And the aftermath is catastrophic for everyone involved. Caitlin's life will never be the same. And who knows if her chiropractor will ever work again. You can't even find his name on the Carolina Spine and Wellness website where he used to work. In one of the articles we mentioned earlier, Dr. Ernst makes another great point. Even if it were merely a remote possibility, the precautionary principle in healthcare would mean that neck manipulation should be considered unsafe until proven otherwise. Hey Chris. Yes, Chris? Can you say that again for the people in the back? Even if it were merely a remote possibility, the precautionary principle in healthcare would mean that neck manipulation should be considered unsafe until proven otherwise. But the story doesn't end there. For instance, the testimony of a chiropractor named Dr. Preston Long, who, for a court in Connecticut, recently listed the family names of 9 unreported victims of the same fate. It is speculated that the stories of many others will never reach the light of day. Dr. Long saw so much quackery in his 30 years as a chiropractor that he wrote a book about it. Pick it up from Amazon and he'll share his unsettling thesis. Most providers have little or no understanding of back pain or how to make it go away inexpensively and easily. Add to that the fact that reliable estimates of the frequency of vascular accidents are prevented by the fact that underreporting is known to be substantial. In a survey of UK neurologists, for instance, underreporting of serious complications from chiropractors was 100%. Those cases which are published often turn out to be incomplete. And in the cases that were reported adequately, time between treatment and death ranged from 1 to 58 days. The longer the time between cervical adjustment and stroke or death, the greater the cause for plausible deniability on behalf of the chiropractor. Back in 2015, an Instagram model by the name of Katie May made headlines when she passed away days after a chiropractic adjustment.
After a model died just days after visiting the chiropractor. The autopsy showed that social media sensation Katie May's death was caused by a neck adjustment.
Only approximately 38% of the victims died within 1 day of their treatment, leaving a larger window of plausible deniability for the others. Not to mention that a case could always be made for previously established injury to the artery. Katie May hurt her neck at a photo shoot, which spurred her initial visit to the chiropractor.
Pinched a nerve in my neck on a photo shoot and got adjusted this morning. It really hurts.
She then went back a few days later when the initial treatment was unsuccessful in treating the pain.
But officials say when May went back, the chiropractor tore one of her arteries during a neck manipulation.
The chiropractor who tore the artery refused to comment, and the subsequent lawsuit reached conclusion in late 2021, yielding a $250,000 settlement to be paid to Katie May's estate.
It should make us all step back and ask questions to our doctors. Well, what are the risks to all the procedures?
But when this type of thing occurs, it seems some chiropractors want to save face and are willing to pay real make this go away money to do so. Another article published in the Public Library of Sciences found equally disheartening results and demonstrated that the literature infrequently reports useful data towards understanding the association between cervical spinal manipulation, cervical artery dissection, and stroke. So even when we lower the stakes so we aren't just focused on death, the data is still obscured. So far we know there is a small but clinically significant correlation between high velocity, low amplitude adjustment of the cervical spine and cervical artery dissection. I wanted to see what chiropractors were saying about why they continue to perform this technique given the risks involved. In the following clip, when asked if he used HVLAs to address patient pain, motion, or both, Dr. Whitcomb, a chiropractor from DC, answers.
My personal sense is more for motion.
Okay.
And pain notwithstanding.
First off, and pardon me for interrupting, but if you're gonna do something that would render me paralyzed, I don't want your personal sense of the desired outcome. I want to know why you're doing it, backed up by rigorous scientific evidence. He goes on to say that in his practice, HVLAs are indicative to him that he is approaching the end stages of treatment.
That's when I see patients really start to take off, to be quite honest with you. They can tolerate high velocity, low amplitude manipulation. We're almost done.
Tolerate. if they can tolerate it? I find that word concerning in this context. Let me explain why. Earlier in this interview, Dr. Whitcomb mentions using less aggressive techniques during the majority of his approach to restore range of motion to his patients.
I will start to mobilize with low force techniques and then move into that as the patient can tolerate it.
What evidence do we have that his patient's progression wouldn't continue if he just omitted HVLAs entirely? The question is especially poignant when we consider that the man sitting across from him is a physiotherapist who, even though he was also trained in HLVAs, favors low velocity manipulation methods.
Like you, I use more low velocity, low amplitude as a means of reducing pain, increasing range of motion.
Right.
Similar results, just without the dangerous cherry on top. Food for thought. Generally, when it comes to neck trauma, and yes, I am comparing high velocity cervical spinal adjustments to minor neck trauma, a neck with better range of motion is better equipped to withstand the forces involved. Perhaps that's why Whitcomb reserves this technique for his younger, more robust patients.
When you get an older patient that just is intrinsically less mobile, thrust manipulation can be counterproductive.
Elderly people are also less resilient in car wrecks. Just saying. You could walk away from a fender bender with minor injuries, or you could suffer a cervical artery dissection. You could walk away from a visit to the chiropractor feeling great, or you could suffer a cervical artery dissection. It's comments like these that move me to shed light on this issue. An osteopath article in the National Library of Medicine explains, HVLA is used to relieve movement restrictions by applying a quick therapeutic force of rapid duration that travels a short distance within the range of motion of a joint. HVLA therapy aims to restore a more normal range of motion within a joint and alleviate pain. Check out this summary of the technique by Med School Made Easy here on YouTube.
The patient's just going to relax. It's going to be the physician doing all of the work.
And I've said it before, especially because the supporting musculature has not been strengthened in the procedure, and it's unlikely the patient's movement patterns have changed as a result. If someone else moves you into a position while you are in a passive state, it will be challenging for you to maintain or replicate that range of motion after the treatment is complete.
And then the direct technique stands for that it's going to be going into the restrictive barrier.
I mean, if you've spent a lot of time training mobility, you'll know firsthand how counterproductive it would be to approach your body's restrictive movement barrier and then have someone quickly force you beyond it. But it's this next part I like the least.
So the mechanism behind it, mechanism is a little harder to understand, and thus we don't quite know it yet.
Before you do something dangerous, you gotta know why. Oh, and to make things crystal clear, this treatment cannot be justified on the grounds that the neck doesn't actually move very far, and thus the vital structures in the neck are never at risk. Hence the low amplitude tag. The thing is, when we're dealing with the elements of the cervical spine, especially the foramen containing the cervical artery, we're dealing with a matter of millimeters. One study showed that the mean diameter of the right and left transverse foramen to be between 2.54 millimeters to 7.79 millimeters and between 2.65 to 7.35 millimeters respectively. Pop quiz. Does the neck appear to move more or less than 5.5 millimeters in this example?
Oh yeah. Yes, ma'am.
How about this one?
If you're a chiropractor out there watching this, there you go.
And what if you're an orthopedic surgeon? No matter how many ring dinger videos I watch, I still find myself wondering what the active mechanism of HVLA adjustment might be. Maybe I'll balance the scales by describing the mechanism of injury that it can cause. A cervical artery dissection occurs when the lining of the artery wall is torn and blood flows into the tear, causing the lining to balloon inwards as the blood is trapped between the torn artery lining and the outer arterial layers. This is a form of embolism which occurs when a foreign object or other bodily substance, like the blood-filled arterial lining, becomes stuck or largely obstructs the flow of blood.
Blood can go into the tear and outside of the true lumen of the artery where blood is supposed to flow towards the brain and into the false lumen.
When a cervical artery dissection occurs and blood flow to the brainstem is compromised, a stroke may occur. also known as,
and lead to infarction of the brain tissue, leading to neurological deficits.
So without sufficient blood supply, parts of the brain become damaged or die. No surprise there. Strokes that occur in this way due to a blockage in an artery supplying the brain with blood are called ischemic strokes and are both the most common type of stroke and the most common type afflicting young people. Even if a patient avoids cervical artery embolism and the acute ischemic stroke, cervical artery thrombosis, which is a blood clot that forms as platelet cells attempt to repair the torn artery wall, could cause the same outcome.
Based on the description of Caitlin's symptoms, it's likely she had poor blood flow into the basilar artery
and suffered an acute ischemic stroke. Remember, her adverse reaction to the treatment occurred in the chiropractor's office. On the other hand, Katie May, who we have mentioned earlier, may have passed several days after her treatment as she developed a cervical artery thrombosis or blood clot. Two different paths with a very similar destination. And if we look at the diagram of the vertebral artery system and the brainstem, we intuitively understand why both are so devastating. Blood flows from the vertebral arteries into the basilar artery, which in turn supplies blood to the back portion of your brain, cerebellum and occipital lobes. With compromised vertebral arteries, the pons and other areas of Caitlin's brainstem would also be at risk. In situations like this, time is of the essence, and the goal of treatment is to control CAD-induced neuronal damage and to restore blood flow to the brain. A form of endovascular treatment called a stent, which is a tubular support structure temporarily placed inside a blood vessel, canal, or duct, can be used to aid healing or relieve an obstruction. Antithrombotic treatment is crucial, and programs may include both antiplatelet drugs and anticoagulant drugs to reduce the risk of stroke. Whether one treatment strategy is more effective than the other is unknown. Dr. Bieber, back to you.
It says that she had 4 injured arteries. It would be very unusual to get a carotid artery injury from this type of manipulation.
This is because the carotid artery runs up the side of your neck underneath the skin and not through the vertebral foramen like the vertebral arteries, allowing it much more freedom of movement. It can still be dissected, of course, but the force required to do so would be much greater and the range of motion much larger, like in an actual car crash or from some other type of injury that causes extreme neck rotation or extension. Unless her chiropractor deployed an even more intense rotational manipulation that was not yet revealed to the world at large. Dr. Bieber speculates.
The 2 vertebral arteries were injured in addition to branches of those arteries, such as the basilar artery.
A study from the University of Baylor Medical Center suggests that the risk for stroke following neck trauma or manipulation is inherently dependent on the manipulation technique and the rotational forces applied to the neck. In a case like Caitlin's, where the damage is so extensive, we must question the level of force that was applied by her chiropractor. It may also matter where specifically the chiropractor is applying that force. An article published in Stroke, Vascular and Interventional Neurology suggests that the V3 segment of the vertebral artery is highly susceptible to the bending forces during forced manipulation, leading to intimal damage. Interns take note. The number system as applied to the vertebral arteries does not match exactly with the number labels given to each cervical vertebrae. The V3 section of the arteries actually corresponds to the C1 and 2 section of the vertebrae. The vertebral artery could be more susceptible to being injured here because the vertebral artery in this region is already tensioned in 2 different directions relative to other locations in the cervical spine. Dr. Bieber goes on to describe his clinical experience with people who have suffered cervical artery dissections, and I have found many other case studies that tell similarly haunting tales. For every case that piques the public's attention, there are many others that will never see the light of day. The rate of occurrence could increase given that in the United States, patients who have multiple chronic conditions are reporting higher use of complementary or alternative medicine, including chiropractic manipulation. Those who choose this treatment should be educated about the risks involved. If, like Caitlin, you suffer this fate and survive the ordeal, there is a long, arduous road to recovery lying ahead of you. After months spent in the ICU, here she is moving her leg for the very first time. And now that she has been admitted to the Shepherd Center, she will continue to work closely with some of the best speech, physical, and occupational therapists around as she works to restore function to her body and brain. I wish her the best. Thank you to Dr. Bieber for helping me break this one down. And before we go, if you're new to the channel and interested in becoming the healthiest version of yourself, check out my online gym, Human 2.0 Fitness right here on YouTube, where we offer free fitness classes for movers of all levels. If you like the video, subscribe and think about tipping my editor. If you didn't, be sure to let me know why in the comment section down below. Some of you have suggested that I start a Patreon since some of my videos get demonetized. So if you think that's a good idea, let me know that too. Thanks for watching. As always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.